My name is Daphne Altima Johnson, and I am a program officer with the Food Communities and Public Health Programs at the Johns Hopkins Center for a Livable Future. I will serve as your moderator for this webinar. So hopefully, I'm hoping by the end of this webinar, you will be able to assess and answer for yourself if diets can be sustainable and nutritious for everyone in the world. But before we begin, I would like to cover some ground rules with you, which is, as you probably can see, every one of you is muted on the webinar to prevent unintended disruptions to our presenters. And if you're having technical difficulties, please let us know using the chat box and we will make our best efforts to address them immediately. And finally, we ask that you use the Q&A box that you can see at the bottom of your chat here for questions, and we will answer them at the end of the presentations. Lastly, I would like to let you know that the webinar will be recorded and accessible on our Global Meatless Monday platform. So today we have two speakers, Dr. Martin Bloom and Becky Remsen, and also we have our very own Peggy New with us, who is the president of the Monday campaign. She's waving, so hey, wave everyone. Very nice. I would like to introduce you to our first speaker. We're just going to jump right in so we can use our time efficiently. But I would like to introduce our first speaker, Martin Bloom, who is a professor at the Johns Hopkins Bloomberg School of Public Health and the director of the Johns Hopkins Center for a Livable Future. He joined the center in 2017 in Baltimore, Maryland from Rome, where he spent 12 years as a senior nutrition advisor at the United Nations World Food Program and as global coordinator for the Joint United Nations Program on HIV/AIDS. He earned his medical degree from the University of Utrecht. I may be butchering that, but he'll correct me. And his doctorate in nutritional sciences from the University of Maastricht. His career includes posts spanning from academia, government, and non-governmental organization in the Netherlands, Thailand, Bangladesh, Indonesia, Singapore, and most recently, Italy. His appointment as professor of the school and director of CLS followed years of service to the Bloomberg School of Public Health as an adjunct associated professor. Dr. Bloom has primarily focused on challenges that include blindness prevention, public health, nutrition, micronutrient deficiencies, food security, and food access, particularly in low and middle income countries. As he states, for any diet-related climate change solution to be sustainable, it must incorporate the importance of nutritional viability for everyone. With his well-rounded and wealth of experience globally, he is no stranger to the complex issues facing the global food system and climate change, especially as we embark in this unprecedented global crisis that is COVID-19. Ladies and gentlemen, please welcome Dr. Martin Bloom. I'll clap for you.
Thank you so much, Daphne. Let me get the slides on. I think I did already, no? Yeah, okay. Can you hear me? Yeah, it's fine.
Yes, yeah.
Okay, good. So let me start to say that I'm very pleased to be here and actually be able to share with you, for me, very, very important information dealing with, of course, the Meatless Monday movement, but also with sustainable food systems. And I think it is actually, of course, we all know it's a very difficult time at the moment with the COVID-19. But it reminds us of the fact that there is a very, very close link between the food system and public health. And sometimes we forget that, particularly in Europe and in the US, in most, the countries which are affluent, because we think, okay, we only have chronic diseases, obesity, which of course are major problems in these countries. But at the same time, we forget, in fact, that infectious diseases will never go away. And quite often, most of these infectious diseases are zoonoses. So they start with the food system. And, I remember when I joined actually Helen Keller in Singapore, Singapore was almost completely broke. And that was because of the SARS. That SARS was actually something happened only a couple of months. So that has huge implications, of course, for the economy. And we recognizing that now in the US, in Europe, all over the world, if you look at the stock markets. Besides SARS and coronavirus, we had MERS, we had Ebola virus, where we were very much involved in my previous job in the World Food Program. And of course, so it starts with the food system itself, but also has huge implications for the food system, because people, in lockdown, they have no access to food, particularly the most vulnerable. So you could see how, in fact, it's almost like a wake-up call for the world, that we should be aware of the fact that the world is all interconnected. We can't just isolate ourselves in our own country and say, we only deal with the US or with Holland or with Africa. We are all interconnected. The humanity is depending on all of us. And I think, we have to keep it in mind. On a personal level, my son and my daughter-in-law are both a pediatrician in the UK. And, what I hear from them, they're very, very busy already with COVID-19. And many health workers all over the world are dealing with it. And I think Italy is a very good example where people are doing like they are heroes, but it's incredibly difficult to handle the situation. But okay, let me start with my presentation. Okay, I do this like this. Before I start, I would like you to share a very good document, which maybe you can download. It's the Food Systems of the Future. It's a synthesis of a report by the Meridian. And what is nice of it is they have 20 reports. They summarize it on one page. But if you're interested in one of these reports, then you can actually download the reports too. But it gives you, this kind of reports would not have happened 10 years ago, when I was working in Rome, because recently the whole world is starting to be interested in food systems, and particularly, of course, in sustainable food systems. And that is something, which is new, which is a very good sign. We are working towards a much, more comprehensive system. And it's not for nothing that the UN is organizing in 2021 a global meeting on food systems, and everyone is trying to prepare themselves. And of course, the COVID-19 is not very, I would say it's interrupting, in fact, this progress. But it's really realizing that we need to work more and more over the next year to make the food system sustainable for many different reasons. So let me start with showing you a couple of graphs by the FAO. So this shows you the meat, This shows you the meat production from 1961 to 2018. And it's very interesting to see that almost the whole meat production in the world is growing dramatically, and this is in absolute terms. So of course, it depends on how big the population is of each of the different continents. Well, so that's a different element of it. But you could see that United States started with about 20 million ton, and now they are producing more than 40 million ton. And in Europe, it actually fluctuates a bit more. But China is one of the biggest producers now of meat, but also Brazil. But other countries, if you look at the United Kingdom, the production is much, much lower, and India is actually very low. The next slide shows you what it means in the meat supply per person over, the period of 1961 to 2013. And you could see it's quite dramatic if you compare the amount which is available per person in the US. It's almost like it's 120 kilogram. You look at Europe, it's 80. So there's a difference of 40 kilogram from a supply perspective between Europe and in the US. So that already tells you that, in fact, that we have to be critical, even when we talk about the high-income countries. There's definitely a big difference in what is available for them to consume. But you see Brazil as a middle income country, you could see that they grew their meat supply enormously in the period between 1960 and 2013. So it is very important to look at the supply, but supply doesn't mean that it's actually consumed. So the next slide shows you what actually people consume. And what is obvious is that in the US, it's the highest consumption, more than 300 gram, per person. But it is in decline. You can see that too, which is very a good sign. Like since the last, I would say, 10 years or so, 5, 6, 7 years, you see a decline in the consumption of meat, but it's still one of the highest. You look at Europe, it's about 100 gram less than what's happening in the US, but Brazil again, the consumption in Brazil is very high. But compare it with India, where you actually have, only on average, maybe 10, 20 gram of meat. So you could see that a country like India is per person has a very, very low intake. So this is very important to keep in mind when we talk about the Meatless Monday, movement. You can see that, you can't have the same type of, advocacy in many of the different countries. So you need more granularity when you start to do promotion. Let me go back to the meat production in the US. So what is very clear is that you started like in 1960, and so in 2018 we have like almost more than doubled, in fact, the production of meat. So why is that? Like, is this something, okay, that's just a normal fact? No, if you really think what the main reason is, in fact, is the industrial food animal production. And so more and more, the meat which is produced is in fact not anymore at farms, but actually at those factories. And of course, these factories have many, many unintended consequences. There's a lot of research done over the past 20 years, and CLF was one of the major leaders in this field, looking into all these unintended consequences: pollution around the farm, pollution of the water, like for example here in the Bay in Maryland, but also thinking about diseases around these farms, like factories, and the workers actually contaminated by infectious diseases. So there is an incredible impact, which is never being paid by, in fact, the farms themselves. Like, so the meat we buy, all the unintended cost is actually never calculated into the real cost of the meat. And that's not even looking into the climate impact. So it's definitely that the type of production has changed in a dramatic way, let alone if you think about the use of antibiotics in these factories. And that has led to an increase of antibiotic resistance. And let me go back to the COVID-19. We know COVID-19 is a virus infection, and we know for virus infection, you cannot use antibiotics. There are more and more new drugs for viral viruses. But the point is that most of these drugs are used for HIV/AIDS, of course, which is, and it takes a much longer time, and you have to be very specific. So, but we can see what the implications are if we don't have a treatment for an infectious disease like COVID-19. The spread will go on, and you see a high mortality, the case fatality rate is high. The same will happen with a lot of bacterial infections when we don't have any more the right antibiotics. So you see the consequences for the use of this enormous amount of antibiotics in farms. It has a lot of consequences for public health. So the other aspect is that a lot of the meat production, which is grown, particularly if you look at Brazil, both looking at the feed for these factory farms, is that they cut a lot of the forest. And this slide on the right side, you can see what happens between 1984 and current. that whole forests are actually cut. And, you know, we all know about the fires in Brazil over the past couple of months. So there is a lot of consequences, not only what the animals are producing, particularly the cows, like the methane. It's also because of all the forest we are actually, you know, destroying because of the meat production. So you can see that the impact on climate, environment of an incredible high you know, production of meat is quite disastrous at many different levels. This slide I've taken from Frank who is a good friend of the center, and he's a professor of at Harvard who has worked with Walt Willett a lot on the consequences of meat consumption on health. And you know, what we know, in fact, is that a diet high in red meat is very much associated with many different diseases like type 2 diabetes, obesity, and cancer, whether it's always the direct intake of meat or the way how meat is consumed is not always clear, but it's definitely a very strong correlation between those work. The problem, of course, if you do this type of studies in nutrition, you don't have, you know, you can't do placebo-controlled trials. So what you need to do is, in fact, using observational studies. And Harvard has developed many large-scale observational studies, like the Nursing study and you know, and Haynes, for example. And that's the way they actually have to analyze what the implications are of these form of consumption. And of course, we're talking about a high meat consumption, particularly red meat. But it's much more difficult to say, you know, what is the amount of meat which actually has no effect. But if you look at the relationship between meat consumption, particularly red meat, and processed meat consumption with cancer, is that the World Health Organization, a couple of years, put all the data together. And what is very clear is that when you use processed meat, you know, particularly like hot dogs, bacon, and sausages, they are carcinogenic to humans for colorectal cancer. And when it comes to red meat, it's a bit more complicated at the moment, but if you look at the data, it's definitely that the direction is all there, but according to the global experts, they still don't feel there's enough evidence for red meat, but it is very borderline. So, so you could see that, and particularly I use the slide by Professor Hu, because I think it's very important because he's the global expert in this field, and so he's very trustworthy when it comes to this kind of data. So, but it's definitely, when you have a very high intake of meat, it's not very good for your health. So it's not for nothing that a couple of, like last year in January 2019, the Eat Lancet Commission came out with a very important paper. I'm a part of the Eat Lancet advisory board, the Eat advisory board, and these kind of this paper was being prepared for almost over a period of 2 to 3 years, when people start to look into the 3 elements like health, food systems, and climate. And they came up based on particularly looking into more overnutrition and chronic diseases, what the most optimal diet would be. And that diet, of course, is a diet which has been designed at the global level. And the paper realized, of course, that the translation, what the diet should be at the country level, is, of course, the next task of many other groups who need to work with this. I can tell you that, like a couple of weeks ago, there was a meeting in Oslo between the EAT group and UNICEF, and CLF and Hopkins had prepared a paper looking into the consequences of unhealthy diets for children who are undernourished. And the meeting was very successful, and most probably we will come out with 3 papers in the next couple of months, showing in fact that this also is important for undernutrition, but I'll come back to that a bit later. So let me go back again to that slide on daily meat consumption. And, and looking very, just to reinforce what I just said before, is that meat consumption per person differs very much among many countries in the world, going from almost no meat consumption to a very high consumption. And when we talk about Meatless Monday campaign, we need to realize that that's one of the important messages. What we also know is that within countries, there's a lot of differences. So if you take, for example, India, it could be that a certain, because meat consumption is very much associated in low and middle income countries with income, that the high income segments of the population will have a higher intake of meat than, for example, the poorest who only can live on staple food, for example. So you could see that there is a difference between countries and within countries. So let's see what that means. Well, these are the Sustainable Development Goals. And someone who has worked in the UN for a long time, but also was part of the development of the Sustainable Development Goals, I believe that these goals are extremely important. And I always ask these questions when I gave lectures to the students at Hopkins. I asked them, say, what is the difference between the Sustainable Development Goals and the Millennium Development Goals, which were actually designed like a couple of years ago, before, in fact, the Sustainable Development Goals. And most of the people, because they're young, of course, they don't know about the Millennium Development Goals. And some of them know about Sustainable Development Goals. But there is a huge difference, because in the past, the Millennium Development Goals were designed for the low and middle income countries. But the Sustainable Development Goals are not only for other countries. These are goals for the whole world. These are inclusive. So they are very important for the US, but they're also very important for Europe and for Africa and for Asia. And that's a huge difference. And I think we need to be aware of that. And I think the coronavirus crisis tells us again that we have one world and that we're all part of the world and that we have common goals. So these SDGs, how we call them, they are wicked problems. So one of the elements of a wicked problems is that they are interdependent, they are multidimensional, they're evolutionary, and they're open systems. That means, in fact, we can't have one strategy to solve them. So let me go to goal number one. And goal number one is still that economic growth, of course, is very important. And part of economic growth, of course, is poverty reduction. And, we have made major progress over the past decades, but still there are still many countries still living in poverty. And about, like, if you look at from a food perspective, about 800 million people are going hungry every day. To tackle the problem of poverty, the World Bank came out with a very important report in 2018, and they called the Human Capital Index. And the Human Capital Index, they realized, in fact, that if countries are not investing in their children, they will not have the most optimal economic growth. And I can tell you that this graph shows you the differences. And it's interesting to see that with the same GDP, you look at, for example, the United States, and you look at Europe, European countries, they have about the same GDP, or no, they have about the same level of human capital, but with the United States having a much higher GDP. So normally other countries, like for example, you look at the Middle Eastern countries, they have a very high GDP, but a very low, much lower human capital index. And also the African countries showing with the same GDP level a much lower impact. While if you look at, for example, the Cuba and Vietnam, as well as China, with a similar GDP, they have a much higher human capital index. So the human capital index is based on 4 different elements. It's like child survival, stunting, education, and health. And let me go to why stunting under nutrition is so important. This shows you an MRI of a brain of a child who is, has never been stunted. And if you look at the right side, this is a child who was stunted. So the brain development has been compromised enormously, what happens in the 2 years. And it's not only the brain development, it's actually a proxy for almost all the development of the organs in those children. So the stunting, which means, of course, a low height for age, is a proxy for many, many poor development in those children. So the cognitive development has been compromised, but also these children are at risk later in life to become obese and actually have overweight or overweight, but also have chronic diseases, because most of the what we call the epigenetics are formed in the early years of life. So you can see how important it is to prevent stunting, even when you think about chronic disease and obesity, and when you think about goal number 1, like the poverty reduction. Goal 2 is zero hunger, and it's, there are many different aspects. This is the dealing with all the agriculture sector. But if you look at from a nutrition perspective, we have all forms of malnutrition, which includes overnutrition, obesity, as well as stunting, as well as acute malnutrition. And what I can tell you from this, what is the most important element, is that many middle-income countries have a double burden. So they have stunting as well as overnutrition and obesity later in life. And what I just explained before, there's a very strong link between being stunted and actually being obese later in life. The third important goal, which is related with this talk, is actually climate change. And we all, can see how important climate change is over the next couple of years. We more and more see very, very, like the weather is changing quite dramatic, and more often than we think it's just based on certain other reasons. So let me go back to the global challenge. So we have poverty reduction, we have improved human capital by stunting prevention, better education, better health system. We need a sustainable food system, and we have climate action. And it's very clear that all those different elements are important. So, coming back to the point of stunting prevention actually is very much related with animal source foods in the first couple of years, and also for pregnant and lactating women. And you would say that's contradicting, because at first you say we have too much, meat consumption in the world, and now you're talking about that animal source food is essential for children not to be stunted. Well, that's actually what nutrition is all about. When you are a child and you are pregnant, it's not that you cannot do it in a different way, but it's much more complicated. You need to be compensated. Like, let me tell you this, a recent paper looking into vegetarian and vegan diets in the US and Europe shows, yes, you can actually maybe have a healthy diet, but it needs definitely supplementation and many actions on the people. And that's, of course, extremely difficult when you talk about most of the lower middle income countries, which need to get their food just from food and not from supplements. So it's very important to realize that milk and other animal source foods are essential, particularly for children, even when you go up to, let's say, for the first couple of years for sure, but most probably until puberty. And then after that, you can actually go much more to plant forward diets, although you still have to keep in mind like vitamin B12, for example. So one of the reasons why we thought, okay, this is really important, the agriculture sector is important, is that the center came up with an important paper and was published end of last year, looking into what a number of diets could do on the global environmental change. And let me show you first a very important component, what we learned. This shows you what we call the baseline consumption pattern, but in principle it's production and imports and export. It's based on the FAO data. What it shows, in fact, is that those greenhouse gases footprint is very different by countries. And first of all, you see a relationship with the GDP, but it's not only with the GDP. For example, if you look at the left side of the curve, countries like Paraguay and Brazil and Chile have a very high footprint. And that has to do with, because they are cutting a lot of forest for some of their agriculture sector, particularly for the meat production. And you could see that, if you go to Denmark, for example, it's a much lower imprint. But if you look at the right side, in fact, there is a very, very low greenhouse gas footprint of countries like India and, for example, Indonesia. So the first diet we checked was, in fact, the WHO advisory diet. Okay, this is also important. Just to show you that, in fact, it matters where you produce your beef. And for example, beef production in Paraguay was 70 times more greenhouse gas emissions than, for example, in Denmark, and Brazil about 7 times. So when we talk about local production, we need to keep in mind that the circumstances for agriculture production, but particularly animal food production, food animal production, is very different from a greenhouse gas perspective. And this we have to take into account in many of these analyses. But okay, let me go back to the graph. And what you see here is when we took the WHO, and we call that the baseline adjusted to dietary recommendation, which is a recommendation based on the prevention of overnutrition and particularly obesity. So it's a healthy diet based on those, not looking into the nutrient content. And what you could see already is that on the left side, that if the countries would adopt the WHO FAO recommendation, many countries would actually reduces their greenhouse gas emissions. But on the right side of the curve, you could see that some of the countries like India, Indonesia would actually increase their greenhouse gas emissions. And quite substantial. And this is the relationship per capita. Keep that always in mind, that even when you have a very small increase of, production of greenhouse gases, but you have a population of 1.3 million billion people, for example, like in India or China, that could have a lot of consequences of your total amount, of course. So this is a very important graph. Like what it shows is, in fact, that you have countries on the left where they would adjust to the WHO, FAO, dietary recommendation. They would definitely improve the greenhouse gases footprint per capita. This is still per capita. And on the right side, you see many countries will actually increase their greenhouse gas footprint if they would adopt. And the reason is that their current production and diet is actually inadequate for a healthy diet. I cannot show you the data because it's still in press, but we looked also into the Eat Lancet diet. And the Eat Lancet diet is exactly the same. Like 2 billion people will increase the greenhouse gases when they would shift to this sustainable diet proposed by the Eat Lancet Commission. And about 4 billion people will actually decrease their greenhouse gases footprint. So it is actually very similar as what we show here, but the data is a bit different. So in countries, you can see here that you can actually divide countries in 3 different groups. One where we can reduce the greenhouse gas footprint, where in fact it will be about the same, and where we can expect an increase of the greenhouse gases footprint. Okay, so let me go to the impact of the several diets. And one of the things you have to learn when you read the paper is that the diets we were doing is much more to show what are the different elements. Instead of saying, oh, that diet is better than the other diet, that's not actually what the purpose is of this paper. The purpose is to show that if you would, for example, go from a healthy baseline, which is already an impact, as you can see, you go to a meatless day, you will have, this is in 7 high income countries, you will have an impact of your meatless day on the greenhouse gases as well as on your water footprint. Low red meat is, of course, also an impact, but the low red meat, the lacto-ovo vegetarian diet, the no red meat, the no dairy, the pescatarian, and the low food chain are all diets which actually are consumed 7 days a week. So you could see that, of course, the impact of your meatless day, which is the starting point for shifting, is quite dramatic, because we just talk about 1 day of change. And then 1 day of change has quite a dramatic impact, let alone if this 1 day will shift then to other diets later on. So I'm very impressed by, I personally didn't expect that impact, which I can see, but it actually is quite dramatic. But it's also to show that most of the people will never take one particular diet. Some of us will, but most of the people will actually mix things. They will move to a flexitarian diet, some of us, and they say, okay, what will be the impact if I move, if I have 2 days a week a pescatarian diet, 1 day meatless day, 1 day, I shift my dairy to, for example, non-dairy milk. That's the type of thing you can play with. And what is very interesting from this slide also is the low food chain. I can go a bit in it because the low food chain is really important. My racial background, I don't know how to say it. My parents are from Indonesia, both of them. And so in Indonesia, what we call the small fish, the ikan teri, is a very important source for poor people. And it's not only important for the protein intake, but it's also important for calcium, for example, because these small fish are consumed not just like the meat, it's consumed with everything, so with the bones and everything. And in those countries, quite in a lot of lower income countries, they don't have, in fact, milk. So they need to get their calcium for these kind of products. And what's happening, because particularly in Asia, a lot of the production of fish is actually coming from aquaculture. And the aquaculture is like 80% of aquaculture is produced in Asia. And a lot of these small fish is used for feed for, in fact, the aquaculture business. And you could see that poor people will have no access then to this small fish anymore, and will have a reduction in their micronutrient content as well as in their protein content. A recent paper in Nature by one of our colleagues, Andrew Thorne-Lyman, showed these kind of relationships. And it's worth it. If you want to, we can actually link you with that paper. This is also an important graph to show, because it tells you what happens 30 years ago. If you look at the stunting levels, for example, when I was in Bangladesh, we had almost 80% stunting levels. So the current population in Bangladesh, in their 30s, 80% of that population was stunted. So they are at risk, of course, of being obese now and cardiovascular disease. And you can imagine what the implications are for that, because if, in fact, the GDP has grown and they have more access to what I would processed food, they are the basis for a lot of double burden process. So it's not only that we have more and more fast food restaurants in those kind of countries, it's the fact, it's the biological aspect, as well as the change of the food environment. So both elements are very important. And that's why stunting prevention in poor countries or in lower middle income countries is an essential component for the prevention of obesity later in life. So we need to keep that in mind. You can't tackle this one and wait for that. You need to do it at the same time. So now I wanted, the last couple of slides, 3 slides, I want to show you what happens in Indonesia. This is really interesting. Look at the baseline, and then look at the baseline of the OECD countries. You could see that the greenhouse gases are incredibly different what we are producing in our countries and what's happening actually currently in Indonesia. And when you have such a low baseline, you can imagine that, of course, everything when you try to improve your diet will actually increase that, but still far lower than the footprint what happens in America and in Europe. And you could see that actually the Meatless Day also in that context is about the same level of what you see with the Eat Lancet or the low red meat. It is, you think, okay, if you have this, then you would say, oh, but we can go to the vegan diet or the low food chain, and that will be the perfect diet because we don't have any problems with sustainability. But it's not as easy when we think about this. So, nutritionists have three ways to look at dietary recommendations. Originally, we focused a lot on the nutrient content of our diet. Then we moved into a much more food group way of approach. And nowadays we look much more as cultural diets. Like, you have a diet from Italian diet or a Greek diet or a Japanese diet. The reality is, of course, that all those three different approaches are essential. But when you talk about low income groups of countries, in fact, the nutrient content is even more important because they are still very deficient. So I want to show you the next slide, which is really important because here we look at the various diets and the nutritional adequacy. And that shows you that even if you look at the Eat Lancet, which is considered as the most optimal healthy diet, is one of the better diets, but still has a lack of vitamin D, a lack of calcium, but also vitamin B12, but also looking into choline. I think I can't see it on the right slide, but I think we have choline too, Becky. I can't see it. Yeah, also a deficiency in choline and zinc. But the Meatless Day is also a pretty good diet too. It's very interesting. You look at Meatless Day, like, Meatless Monday, like it's even in this context is still, of course, not adequate because of that we don't have adequate diets yet in those countries. That's why we need to improve that. But if you go, for example, to a vegan diet or a low food chain, you can see there's a lot more red and there's hardly any green except for protein. And protein, in fact, you don't look into very, like all the essential amino acids. So you could see that it's not only thinking about the climate important, it's also very important to keep in mind, particularly in all the low and middle income countries, that we all have the right nutrients. And the combination of nutrients as well as sustainability is extremely important. And of course, what I mentioned before, I have to repeat that, is the double burden. The double burden is one of the key issues in many countries like Indonesia, a very good example, where I see a rising increase in obesity in a stunted population. So in conclusion, I want to say about the cost too. Sorry. The cost is very important because, like, there's a paper out looking into Eat Lancet. We also come out with a paper here about Indonesia looking into the cost. I work very closely still with the World Food Program on this. And, the graph tells you that almost 50% of the population in Indonesia cannot afford a healthy diet at the moment. Another important finding of this, let me go back to the other slide, I think. Yeah, this is an important slide too. So it's a bit, I don't know, like I can tell you that's made better. This is important. This is the same slide. You look at the Eat Lancet, and if you look carefully into the data, and maybe I can use yes, can you see my pointer? Okay, you look at the Eat Lancet diet, and you could see that this is the amount of rice as a percentage of the total diet. This is your baseline. Every food economist will tell you that the part that the staple food component of a diet in low and middle income countries is really essential, because that actually, when that shift, when that change, then in fact they have more money available for what they call the non-staple food component of the food expenditure. People in these countries, they consume between 40 and 60, 70% of their income to food. So there's hardly any change, and that's why the staple food is very important. We in the US and in Europe, we only spend 10% of our total income on food. So the point here is that if you want to reduce your staple food component in your diet with 50%, that's not unrealistic. That's not realistic at all. That's almost impossible. So you can see that you have to do a lot of work to closely working together with the agriculture sector to find alternatives. So, and it's, we can go into that, but it's a really important component. Like, you can't have only working with nutritionists or with climate people. You need food economists to tell you, and agriculturists, whether these kind of shifts are actually possible from an agriculture and financial perspective. So in conclusion, the Meatless Monday is an extremely important strategy, because coming from the UN, I never actually have seen a global movement dealing with the issues we want to deal. We always try to influence governments, but I never worked with something which I worked in the past 2 years with a movement with actually focusing on consumers. So the Meatless Monday is a very important strategy to reduce meat consumption in high income countries to improve health, but also to reduce the greenhouse gases and the water footprints. But I also feel that the Meatless Monday movement is very important for low and middle income countries, because it's an important strategy to guide countries in the prevention of the double burden of malnutrition, as well as developing more sustainable options for food animal production. Thank you.
Thank you. Thank you so much, Dr. Bloom. This was such a great overview, a great presentation. I want to say that I see that you guys have some questions. Please keep them coming using the Q&A section of your screen on Zoom. But we're going to proceed. I promise we're going to get to them. But now I'm going to proceed to the second part of our presentation, which will come from Becky Remsen, who is a Senior Program Officer with the Food Communities and Public Health Program of the Johns Hopkins Center for the Future. She's primarily responsible for managing the center's science advisory role with the Meatless Monday campaign. And prior to her tenure at CLF, she worked with University of Maryland as a technical advisor for nutrition and food security for projects in Afghanistan and Ethiopia, helping women produce and utilize food for family consumption and income generation. Additionally, she is a registered dietitian with clinical experience and believes good nutrition for everyone relies first on a healthy food system. Ladies and gentlemen, Mrs. Becky Remsen.
Thank you. And let's see, I'm going to share. Martin, you need to unshare your slides.
Oh, sorry. Oh, okay.
It's okay. It's all right. I should be.
Let me go. I'm stop share.
Perfect. That's great. And I can share.
Is it all done?
Let's see. I'll try again. Yep, that should work. Yep.
Okay.
All right. Here we go. All right. So, all right. Thanks. I'm just gonna take a few minutes and just add on to what Martin has been saying and kind of bring it back to how us as practitioners and health professionals, or those of us working in policy, can really take this message. It's really important information. It's very nuanced information that Martin has shared with us. We are just so fortunate to have this insight, and I think it's very unique. So as Martin said, the impacts and strategies differ by place. You have places like US, UK, higher income countries where there's there's plenty of food on the shelves, where we have larger portions of meat on our plates in general, not for everybody. But in those cases, consumption is more than the recommendations for needs for protein and animal products. And we also have a higher risk from low consumption of vegetables, whole grains, and legumes as well. So we have both of those going on. So the message really in this, as we as practitioners are talking about how we can make these dietary shifts, is that we do need to limit our meat, and we need to replace them with plant-based healthy foods. In countries where staples are really the, subsistence farming is one of the main incomes, and staples are make up the majority of the diet with smaller amounts of proteins and micronutrients. The message is going to be very different, because even in these countries, there's still this shift that's happening toward more processed foods, sugars, and oils, and how food is produced as incomes change and diets change is really important. So we need to be there. We can't go business as usual as these diets change. We need to have a different paradigm and different approach to diets. And so the message there is really that a healthy meatless day, how can we make that meatless day healthy to ensure protein and micronutrients, and also enable people to have the protein that they need in from all sources. But Meatless Monday really has a message about this healthier baseline diet. In countries such as, especially in all of these cases, but especially in higher and middle income settings, Meatless Monday, and these, we've seen from our research and following people who do Meatless Monday, that these dietary shifts can help us move toward healthier, more sustainable diets. So for instance, this is what we've heard. A person is going out to eat, and they're at a restaurant, and they see a Meatless Monday item on the menu, and some friend says, oh, you should try this. And so they try this vegetarian taco. They say, hey, this is pretty good. They put it on Instagram, hashtag Meatless Monday, and then they might go home and start to well, let's try those tacos at home. Let's try a different recipe. Let's share it with our family. And so this is a way that we see this one day a week turning into other changes. And we've seen this in surveys that we've done, that people who do Meatless Monday make other changes by and large. So there's a big message in this smaller shifts, because we know it's hard to make the larger shifts. And also, we've also seen that people, health is one of the biggest reasons that people will start a Meatless Monday, like because of their health, because they're trying to control their weight. And they will try that food again. But then, as they're saying, as they start for health, they say, well, I actually, they hear more messages about diets being linked to climate and environment, and say, I can do this. So they're opening up into other areas where they may not have thought about climate and diet before, but they're able to make that connection because they've made it for health. We know that it's hard to become a vegan. You've seen from the slides that Martin showed that we can have a huge impact with vegan every day, but that's a difficult shift. But we do also know from our research that if you can take the current vegans and vegetarians, it's pretty much equivalent to only 30% of people this is United States only, doing Meatless Monday. Whereas then you get 50% of people do this one small change, you can make even a bigger impact than the current amount of vegans. So this collective impact is important. Beyond individual, we know that we can take this message into what we really need to do is work institutionally and with our policy and our governments. And so Meatless Monday has been used and can continue to be used in cities and food policies, in institutions and restaurants, in sustainability offices, as they're talking about what they can do about the climate and the food. So we can take this message of Meatless Monday. We really see it as a way to focus on nutritious food, not just taking meat out, to promoting a meatless day as an action toward a solution. And we do know that this one day, one choice can change awareness and openness to making changes. And it can be implemented in many different settings, from individual to more policy levels. And we really, we're all in this together, and we need to share what we're doing, and all of you are in this field, and we need to share how we're helping people make these shifts, because it's not, as we've seen, it's not one solution, nor is it one approach. One thing you've seen, many of you are part of our global community, that we've made this free community where we can share and post resources, have discussions and forums, join groups around your affinity groups. Like if you're a nutrition professional, there's a group. If you're a chef, there's a group. We can form new groups based on regions. If you want to get everybody from your your country or your region, we can form groups that way. But we have a whole resource section on this site where we are continuing to build. So there's the website is there. If you're not a member, please join and also share. And this is not something that, we will put resources up, but we also want your resources and your sharing. This is where we're learning from each other. We have resources such as like from our paper that Martin talked about. We have some materials that you can take break it down into what does it mean for Meatless Monday, and some more data. We have resources from our center, the curriculum. We have a food systems curriculum that you can take parts of and teach it. You can it's aligned to the K through 12 curriculum, actually the high school curriculum here in the United States, but can be really adapted. I've adapted it in many different settings, even before I started here at CLF. We have fact sheets that you can take to your policymakers about why meat is important for the environment. And then Meatless Monday has also they have some great resources on how to implement a Meatless Monday program if you're going to do it, and how to even getting it in your city, so on their site. So these are all available. And here's our sites and some contact information. And I'm going to just pass the mic over really briefly to the president of Meatless Monday, Peggy New, who can talk a little bit more about what their future plans are. And then I know we've run late, but we will be on we have a few questions that have come through, and we're here at least another 15 minutes if you can stay on with us. So Peggy, go ahead.
Yeah, thanks. I just really wanted to very quickly thank everyone for joining. It's a tough time, but of course we're all working virtually, so maybe we can have more of these webinars. And I just wanted to acknowledge the diversity of the Meatless Monday movement. It actually has spread now to 40 countries and 23 different languages. We kind of for shorthand call it Meatless Monday because that's what we call it in the US. But there's Meat-Free Monday in the UK, Green Monday in Hong Kong. In many countries, it's Thursday because restaurants open more. So the idea of this is to, come up and adapt the concept in a way that works in the context of your country and the language. And of course, there are other strategies other than one day a week. I think the best use of it, however, is to reach a broad segment of the population with that first baby step. It's kind of the gateway. And also, which a lot of the initiatives have found, it's a great way to leverage the weekly promotional cycle. So media is on a weekly cycle. It's a really easy, way to tap into social media, use the hashtag, do promotions in restaurants. So we're incredibly eager to learn from everyone. Please get in touch, share your insights, and let us know what else we can do to help you. So thanks very much, and I'll turn it back to Becky.
Yeah. So. Daphne, do you want to are there any questions that we need to address?
Yeah, I'll take over from here. But thanks again to everyone actually who participated. I do want to say that if you have to jump off this webinar, it is recorded, and we will be posting it. Send out a link to the recording to those of you who have colleagues who weren't able to make it. Initially, it will be posted on our platform. I will say. We have some questions which I'm really excited about. Dr. Bloom has answered some of them, and I'll go over what he answered very quickly, and then keep them coming. We'll answer them to the best of our abilities. So can you hear me, Dr. Bloom?
Yeah, I would like to reply to one quickly, because some of them I can already do typing, but...
do you want me to read the ones you've already replied to?
No, but I will start with Tim because we don't have that much time. So I was wondering maybe, and Tim Thorpe asked an important question. I think he said, why Meatless Monday? I think it's much better than a general reduced meat message. But is there much evidence that this is an effective method for changing dietary behavior? Well, let me tell you what my opinion is about. It's like, what I said before, I worked for a very long time, the last, I would say 13 years in the UN. And we dealt with, the food system. We dealt with infectious diseases, with, what I said before, with HIV/AIDS, but also with, with a lot of the trying to work with social marketing campaigns to improve to change the dietary intake in many low middle income countries, of course, promoting certain foods. Here in the US, of course, and in Europe, to decrease certain food items like meat. The point is that why I am so incredibly impressed, and you must understand, like I just started 2 years ago and have seen what Meatless Monday has done, is that the concept of a Monday, I personally believe, is very important. Although we mentioned in our paper just a day. The reason why we mentioned a day, because some other countries do another day. And it could be, when you are in a Muslim country, for example, Friday is the Sunday. And so that means, in fact, you have a different day. But the point is that Monday is very, very, very important, because it's the day what you see as the 1st of January that you feel, okay, I did something over the weekend, was not that great, like, too much alcohol. And Monday, now I'm going to not drink this whole week, for example. So Monday is a day of potential change. And I think that's why I think it's good when it's very, very specific. I agree with you. It's always good to have general messages about reducing meat, but having one particular day which you can focus on can be the beginning of change. And I believe that human beings need a lot of assistance, and saying, okay, oh, it's my Monday. Okay, now I have to do it. Like, and then they start to think about it. And what I love with the Meatless Monday, it's not they give a lot of recipes. They show what is possible. It's an entry point. Like, and again, I'm not a social marketing person. I'm just a physician. I'm just like a technical person working in this field. But it influenced my thinking even. Like, I every Monday I think, oh yeah, okay, good. And I don't have an issue on other days too. But for me, it's an interesting day. I always think about Monday, about Meatless Monday. So is it is it the only way? No, of course not. I agree with you. There are many different, marketing systems we need to use. But I love Meatless Monday. That's the only thing I can say. There's a lot of other good questions. Please, we will also about literature. I think it's a great idea too for us, Becky and Daphne, to think about a list of important papers, on different topics which we can share with you. Or we put it on a website, for example. That's maybe better on the website of Meatless Monday. Maybe we can discuss that with, if that's possible. I don't know, but at least at CLF we can do that.
Mm-hmm. Yeah. There's a few questions about, what do we know about, are there other spillover effects to Meatless Monday going, people eating more meat on other days? And
no,
surveys that we've done really show that people who do Meatless Monday are doing it because they want to, reduce their meat or make a change. And so they actually will make other changes throughout the week and will open up other changes. The only time we've heard of spillover is maybe when a university setting with college students who they take all the meat off or don't have enough meat, and the college students next day will want to eat more meat, and that can happen when it's forced on you. But when it's a personal choice, and it's offered as a choice, people who choose it will often will do, because they might like the food and decide that they'll try it again, or they become more comfortable with these types of foods. So that's what we've seen. We do have on our website and actually on the site a white paper that we did just on what do we know about Meatless Monday. So again, you have my email, and we can send that when we send out the slides. We can send out some of those resources as well. Martin?
Oh, I see another very good question.
Okay. Very good question from Erica.
It's a very important question.
Can I just read that real quick first? Read the question.
Okay, yeah, sorry. How do we take into account livestock production that builds soil carbon and improves landscapes like regenerative and holistic agriculture? There's a growing movement from what I've seen locally where I live in Northern Ontario and even nationally in Canada. Well, first of all, let me tell you that I think that this the regenerative form of agriculture is really important, because it's important that we revisit the way we do agriculture production, whether it is in animal food production or whether even it's like, you look at, for example, our staple food. I'm not saying there's no role at all, but we really have to revisit. And I can tell you that report which I sent at the beginning, almost every report is very critical about our current food system. Well, that's number one. It's gone now. But the other element, which you were saying, is very important, that it has multiple positive implications when you start to switch. Like you look at, for example, pollution, look at all these unintended consequences. So one of the things we had yesterday a discussion with a potential counterpart, thinking about looking into the what we call the unintended cost and the externality of the current system, comparing with the what you just mentioned, the alternative forms of production. And that's really important, because if you look at the real cost of food, the real cost of meat, is just absolutely far, far more expensive than we are paying for it. But we are still paying for it because we're paying it for through our health, also through our tax system. And so it is time for us to realize that we need to measure the real cost of food and looking into the alternatives, because then so much more subsidies can go to the alternative forms of production.
All right. I'm unmuted. Okay, so I think we are running out of time, and this has been really, really productive. We've really enjoyed having you all on, and we hope we've answered your questions, and it's been something great to think about. Let's continue this conversation join our community. There's a forum there. You can ask a question. We can have these conversations. Join a group. Contact us. And we definitely want all of us who are in this field to be a part of the solution. So, and we need all of our ideas. So thank you again for joining us. Any last words, Peggy or Martin?
No, I just say stay tuned for more webinars. This is just a first in the series. So we're going to announce additional ones that get into different aspects of this, different practical resources. So let us know what topics you'd be interested in, and we're happy to work them in.
Great.
Good.
Great, thanks. And thanks again, Daphne, for doing a great job moderating. And we will hopefully see you all again. Enjoy your day and stay healthy and safe.
Yeah.
Thank you again.
Thanks, everyone.
Everyone.
Bye.
Bye-bye.
Bye.